Welcome back to the BioHub. Today we have an extraordinary guest joining us, Michael Parini. Michael is the CEO of Spur Therapeutics, a clinical stage biotech company dedicated to developing transformative gene therapies for chronic debilitating diseases. With over 20 years of experience as a senior exec in the biopharma and biotech industry, Michael has held key roles at Vertex and Pfizer before joining Spur. In this episode, we'll dive into the exciting rebrand of Freeline, now Spur, what inspired Michael to join the company, and how Spur is approaching gene therapy in innovative ways. We'll also discuss the challenges of reshaping the company, maintaining stability and culture, the importance of diversity and inclusion, and how Spur is making a difference for patients. It's an absolute pleasure to welcome Michael Parini. How are you, Michael?
I'm doing great. Thanks for having me. I'm excited about our conversation today.
Absolute pleasure. So, Michael, could you start by introducing yourself and giving us a brief overview of your background and journey?
Yeah, I'd be happy to. So, as you mentioned, I'm the CEO of now Spur Therapeutics, which is a really exciting time for us as we sort of follow the journey from an early stage gene therapy company to starting our first phase 3 trial next year. So it's been quite a journey, even at Spur, the last 3 years. But I've been in life sciences my whole career. I'm actually a lawyer by training, so I spent the first 5 or 6 years in private practice in a law firm, and made the move to Pfizer as they were one of my clients. They recruited me to come in house, and really got to experience what it's like to be in a vibrant, global, and changing at the time, really, biopharma company, and just loved the ability to kind of spend my time and energy working on really important issues to help patients. And I think that is sort of the motivating force for really my entire career. And so after 12 great years at Pfizer, I had an opportunity to join an even more amazing company in Vertex Pharmaceuticals up in Boston. And so I joined as, again, a lawyer there, but pretty quickly moved into a much broader role, sort of looking after all different kinds of parts of the Vertex organization, from HR to corporate affairs to quality to business development. And so we really operated as a small leadership team that kind of oversaw every aspect of the business. And I learned a lot of important lessons from some really thoughtful and talented people at that company, and we had the privilege really of transforming the standard of care for patients with cystic fibrosis. And met a lot of patients during that time, and learned a lot about what it truly meant to be patient-centric, to be really focused and driven, and what it takes, I think, to succeed in creating transformative medicines. So that was a fun 5 years. It was a tough 5 years personally, a little bit. I was living in New York, commuting to Boston. Wow. So that was. I have three boys and a wife, and so that was a pretty tough personally, but a really rewarding time in my career. And so when Freeline approached me about joining their company and sort of and having the ability to really steer and shape Freeline's future at the time, I sort of jumped at it, and I could work from New York and spend a lot of time in London where we have a bunch of folks. I still spend a fair amount of time in Boston, but it's been 3 pretty wild years. But we worked really hard to create the opportunities that sit in front of us, and so I enjoyed every minute, and I'm still enjoying it, and really proud of the hard work and the great contributions from the entire Spur team.
That's amazing. I think sometimes when I ask that question to execs like you, it almost sounds like every move is calculated, and it's like, this is the roadmap to CEO. In your case, it really doesn't seem that way.
No, it was. It's funny. I went to college and I was pre-med, right? I was going to be a doctor. That was what I wanted to do when I grew up, so to speak. But went to school in Washington, D.C., and sort of fell in love with healthcare policy, and did a lot of work on the Hill, did a lot of work in that environment. Mm-hmm. I felt like, hey, this is a chance to not help one patient, but to help many patients and have a bigger impact. And so I sort of quickly moved over to law school, always worked in healthcare, And during my time at Pfizer, I had some really great clients I worked with on the business side, some of whom encouraged me to join the business. I worked a lot with Olivier Brandicourt, who left to become the CEO of Bayer and then Sanofi. And so he encouraged me to join the business. It's never kind of matched up. And I always liked being sort of a business friendly lawyer. And so I worked closely and really tried to understand the business side because I just think it helped you be a better advisor and counselor and really earn your seat at the table as an attorney. So when I got to Vertex, Jeff Leiden, and then CEO, I think it was 10 months in, was like, hey, you could do more. You should take on more. And more was hard, more was fun, but I got to learn the whole thing and sort of whet my appetite to say, maybe I should do this and maybe I should make a jump over. And ultimately did, and honestly didn't really map it out this way, but I'm one who doesn't look back, and I'm super appreciative of the opportunity.
No. And then what inspired you to join Spur? And then how do you balance the demands of your role with maintaining a healthy work-life balance?
Yeah. On the first part, I sort of I was at Vertex for 5 years. And so it's a combination, I would say, of sort of professional interest, but also some personal aspects to the decision. I was there till 21. And so in 2020, this little thing called COVID happened.
Mm-hmm.
And as opposed to commuting to Boston every week, and I had a pretty aggressive commuting schedule, Max. Let's just say that I would fly up on Monday morning at 6 a.m. I'd work till Wednesday night. I'd fly home Wednesday night, spend the night with my family. As I like to joke, like yell at my kids, say hi to my wife, and then I get back on the plane Thursday morning until Friday night and fly back. So
Wow.
it was pretty taxing. And then COVID happened, and I was working from home. I was spending a lot more time with my kids. They were sort of in this critical high school years and late middle school years. And I really like my wife. So we kind of said, hey, maybe this would be great if I could do something a little closer to home. And then just sort of happenstance, a board member from Spur reached out to me about an opportunity and said, hey, there's this company. They have, most of their labs are in England. Their headquarters are in England, but I think they'd be willing to sort of give you a go from New York if you're up for it. And I got to talk to some of the board members. I talked to the chairman and really liked what they were trying to do. I think they had some challenges too, which maybe attracted me. I thought it was an opportunity to really improve where they were heading as an organization. And so I took the leap, and that was, a little over 3 years ago. And like I said, no regrets, no looking back. It's been quite a journey.
No, amazing. I think sometimes the best opportunities look, as a recruiter, I always say this as well. You never know when that next opportunity is going to come. You almost always have to be talking.
Well, it's funny. I give a lot of advice to more junior folks, and they always, especially some of the lawyers, are like, how did you get over to the CEO side of things? And I always say, like, if you start laying out plans for your career, and I'm going to check this box and check that box, and it's going to get me somewhere, that doesn't really happen. It turns out the best thing you can do for your career is just be great at your job.
Mm-hmm.
and be curious and want to learn about everything around you, every aspect of the business, even if you're in a functional role. And I think I sort of took that attitude personally, and it just made me super curious about everything that we do, every part of the process of discovering and developing medicines and bringing them to patients. And Vertex was a fantastic place where I got involved in every single aspect of the business. We had a no swim lanes slogan where everybody on the leadership team was sort of collectively responsible for the whole. And I think I brought some of that forward to Spur, and I think it's served us well.
No, I like that. That's almost like Steve Jobs-esque kind of mentality.
We had a great leader. Jeff Leiden was the chairman and CEO of Vertex, and really transformed that company, together with some other really smart leaders like David Altshuler and others who sort of reset that strategy. But there were 6 of us on that EC, and you better know everything that matters, and you better drive decision making. And there was absolutely no room for passengers. We were all drivers, and I think that's a real secret to their success.
Yeah. Let's talk about the rebrand. So, what's the significance and thinking behind the new name and the new brand?
Yeah, it's first of all, it's a super exciting time. Something I've never done before, so that was kind of cool. I think it was, we've gone through a lot of change in the last 3 years as an organization, and part of that, frankly, was necessary. This was a necessary reorientation for where we thought we as a company deserved to win and where we could help patients the most. But it did result in a pretty fundamental change in our thinking in terms of how we operate, what our strategies are, what's our even purpose, why do we exist, and where do we think we can actually add value to all the stakeholders that care about life sciences companies like ours. And when the dust settled, I would say sort of at the end of, really the end of 22, first half of 23, we just were a fundamentally different company. And so when we went private, earlier this year, and we had an opportunity to acquire another company, we did say, like, hey, I look at who we are today and I look at who we were 3 years ago. We're just fundamentally different. Every aspect of, our strategy, the way we operate the company, our culture. And so we said, this is just a great opportunity to sort of take that step back and really capture our essence of who we are as an organization and what we think we're going to contribute to the continued progress of gene therapy forward as a modality. And so we spent a lot of time thinking about it, and had really nice conversations about what are we trying to capture in our new brand. And Spur just sort of brought all that to, we think, a very succinct and simple idea that we want to spur, gene therapy forward towards the next wave of innovation. And I think gene therapy is a modality we believe strongly in. Most people ask me why, and I say because it works. And I think that there's lots of cool things out there and lots of shiny new technologies that have promise. We know gene therapy works. I think it's just how you practice genetic medicine is really what we're focused on at Spur. And we want to be catalysts for change. We want to be catalysts for sort of gene therapy. Maybe it's 3.0 now, not 2.0, but that's sort of the spirit and the essence behind the brand. And I like to move. I never sit still. So we wanted something that captured this idea of movement. And I think Spur sort of evokes the real essence of kind of who we are as a company.
That's actually so important. I don't think a lot of companies always realize that as well, like defining who you are as a company, the kind of individuals that are also in the company as well. Like you see probably the last 5 years or so, companies like Netflix, like Airbnb, really redefining what culture is and why it's important and why you should spend time on it as a company. I really get where you're coming from massively.
Yeah, and it's funny you mentioned some of those companies. I mean, I like to read a lot of books about companies that have succeeded and failed and all that stuff. And I've always felt that the culture is critical. It's just so critical to not just capturing the level of ambition and goals of the organization, but just how we work every single day. I mean, this is hard stuff, and you really need the right people with the right level of buy-in who believe in that mission, but also believe in each other to be successful. And so when we think about, kind of where we were a few years ago, Freeline was about, freeing patients from, frankly, their infusion obligations to be treated. That's not really what we're trying to do, and that's not really how we do it. Interestingly, we're trying to transform people's lives, and it's not about a one-time treatment's more convenient. It's actually, we think we can do better than the treatments that are out there today. And by the way, we're going to do it in a way that frees you of a pretty significant treatment burden. And so I think for me, it was important to kind of take that step back and say, what makes us special, what makes us different, so that we deserve to be the people who can change people's lives and the diseases that we go after. And I think Spur just has that energy that I know I feel, and I know the team feels each and every day. After going through a pretty tough set of challenges to get here.
Yeah, I want to talk about the challenge, some of the challenges as well. Like you led a significant reshaping of Freeline, now Spur, reducing the team from 300 to 60 people or so. What drove these
Yeah.
changes?
Yeah, I mean, look, it's been a hard, and it's been a hard 3 years in that sense, because I think we had a lot of really good people at the company, but for me, when I joined, I knew there were challenges at the company, and I went in eyes open, and I thought the challenges were mostly execution, right? We just couldn't execute and drive our progress forward, and for an early stage company, you got to execute to demonstrate the value of your programs, because that's the only way you secure additional funding and you drive forward. But frankly, I kind of saw pretty early that we maybe had some more fundamental challenges in the way we were approaching our work. And so I just took a really hard look, and talked to lots of folks on the team, talked to my board, and said, I don't think we're going to win. And by win, I mean come up with the medicine that patients really need to change their lives with our current approach. And I saw two big challenges. One, I think we were working on the wrong diseases. And two, I think our operating model was not going to be successful in the world of biotech that I knew. And so when we sort of aligned on both of those points, there's kind of a natural set of consequences from all right, well then what do you do? If you're going to decide not to work on these projects, what are you going to work on? And so we sort of went through the whole portfolio, clinical stage, research, and all agreed, Gaucher disease, we have a tremendous amount of innovation and a real opportunity to set a new standard of care. Now, it was third in our pipeline, not yet in the clinic. And so we kind of had to hold hands and say, but we believe in this one. This is the winner. And so we ended up shutting down the first two. And with that came, some teams that supported that, certainly some CMC and other capabilities that were oriented towards those programs. And then we reset our scientific strategy. So we really looked hard at the organization and said, where are we special? What makes us different? Where do we think we can actually come up with a differentiated approach that sets us apart from other gene therapy companies and other companies working in our diseases? And we saw great expertise in sort of on the capsid side, and the vector design side, on protein engineering. And so we really just focused on those areas where we had strengths, added a little bit where we felt like we had gaps in our capabilities, but then just did a thorough assessment of the entire organization and said, hard assessment for sure, but I just felt like if we see these opportunities and we're excited about them, and we're gonna have to do it the way that is sustainable, is financeable, and highly focused on the things that add value for patients, because that's where we're going to end up adding value for shareholders and other stakeholders. And so it was a tough year and a half to get from 300 to 60. But I think in hindsight, it was absolutely the right decision. I think we're creating more value with fewer, more very dedicated colleagues, and I think it's sometimes you got to go through tough spots to get to a really good place, and I think we're an example of that.
100%. Yeah, I mean, you just said in hindsight, you made the right decision. I think when you were making these changes, did you ever doubt you were making the right decisions? And I suppose how did you deal with that?
Yeah. Well, I mean, yes. The short answer is yes. And I was the first time CEO, right? So
Yeah.
I'm walking into an organization that, frankly, I thought had some challenges in executing, but I think pretty quickly, I said, I think we actually have a more fundamental problem with our strategy and our portfolio. And so there's no question. I wondered, like, I've never done this before. Am I making the right decisions? And
Yeah.
I think I got comfortable because just my process. My process is I love talking to really smart people. I love having people challenge my thinking, have people challenge each other's thinking, and really debate things. And I'm again, I said anybody can disagree with me. In fact, that's your job, is to tell me when you think I'm wrong. Uh, but I had a very strong conviction that, just again, been around the industry a long time, us going after diseases where we had the same approach as others in rare disease with relatively small patient populations, certainly for the first disease where there's about 6,000 patients in Hep B, just that is not going to win.
Mm-hmm.
And I know we might get there, but we may end up, dying on that hill. And I just said, that's not where we're adding value as a life sciences company. And so I had a very clear sense that these are the areas we need to be in. There were times where, like I said, no regrets, but I would say I wish I maybe acted a little sooner.
Okay.
And some of the decisions I knew we needed to do it, but I was trying to balance, like, how much organizational distress can I impose at the same time? Because I did feel like we had a really strong core of innovation in the UK. We were building a team. I replaced the entire leadership team. Every person on the leadership team is now, they've all been in place for 2 years. But before that, we had tremendous instability at the top. And so I felt like that was important because that's a group that really drives and steers the organization. So I might have done some of it sooner, I think, but at the end of the day, as you sort of make these decisions and then you continue to execute and you see the rewards of it, I think we're starting to see that now. It does give you a little bit more confidence, which, as a first-time CEO, has been super helpful.
Yeah, I imagine you had this thing in your mind, thinking, "Wow, this CEO has just come in and suddenly, the whole company's completely changing."
Yes, and we also had an interesting dynamic, intercultural dynamic, I would say. When I joined, most of our employees were in the UK, right? We had about 275, 300 employees. I would say of that group, 90% were in the UK. We started in the UK. We started out of London. And we hired a lot from academia.
Okay.
And so, you had a new CEO come in who's an American, who's very direct, let's say, and likes to go fast, which wasn't, I would say, is not exactly the culture we had, just given some of our academic roots and the way that the team had worked to date. And so we definitely had, every time I showed up in the UK, I think people were like, what's happening now? So I learned to just increase the amount of times I go and just have coffee with folks, just hear what's on their mind, hear their thoughts. And I think through the process, I just sort of learned, like, hey, you guys have your own doubts that we're working on the right stuff. And I do think in time and through lots of transparency, everybody, including the folks who left, felt like we were making the right decisions. And I think that's probably one of the things I'm most proud of, is just the way we sort of handled all the changes that we went through.
Yeah, because by the sounds of it, the people who were left behind in that 60, they stayed for the ride as well. Whereas, like, the amount of conversations I have as a recruiter with people just messaging me going, "Max, can we talk? Oh, there's a bunch of instability in the company I'm working at now. I just need to check what my options were." It sounds like you didn't really have that.
Well, it's remarkable. When I joined, I think our attrition rate was in the mid-20s, which is like 1 out of 4 are turning over every year. That's a hard way to build a culture. It's a hard way to sort of drive projects. There were a lot of challenges with that. And we went through all this and we sort of we had 56 colleagues when we sort of finished all restructuring, refocusing, relaunching our scientific strategy. I think in the last year and a half, we've lost one.
Wow.
I think we have 55 of the 56 are still here. And I think the key to that was just incredible transparency and authenticity. Like I just feel like, we have to be honest about the challenges we're facing in the external environment. It's been a tough financial environment for gene therapy companies. I was just very open about it. And I also think we gave a lot of support to the people who are staying, but I think in a weird way, we gave just as much to all the people that were leaving. And, they're friends. They're their friends. They worked side by side for years in many instances. And feeling like we treated them with respect, and we listened to them, and we heard their concerns, and we tried to support them. I mean, I remember a call after one of the reorgs from a lab tech in our German facility. We were making reductions in our German facility at the time, and he called me early morning his time. This was the middle of the night, our time in New York, and I answered the phone. And I ended up talking to him for over an hour. And, honestly, he was very upset. He was scared. He was concerned about, on his ability to support his family. And I listened. Obviously, it was the right decision. We made the right decision. We didn't change it. But I do think, like, he was surprised that the CEO would spend an hour at 3 a.m, talking to him. But, honestly, that's the kind of approach you take if you really want people to know, like, we're doing this, we think, for the right reasons. We're doing this because we believe these are the right decisions to ultimately achieve our goal. And, honestly, they talk about it. And I think it really helped sort of the survivors, if you will, feel like we were treating everybody fairly, and we were being incredibly supportive, and, connecting them with our networks, trying to help them, get new jobs. We had really, really talented people that we just had to let go for good reasons for the company. But, supporting them through the transition was just as important as being there and supporting the folks that were staying.
No, I completely agree with that. And, like, there's a bunch of companies that definitely do support, but it doesn't necessarily sound like the support that you guys gave, which is why you've then had those outstanding results from the people who have stayed.
Yeah, and it's like we're still all, we still have all of our friends and networks, and I get, I think yesterday I probably got over 50 congratulatory notes from people that we let go, saying we're still rooting for you guys.
Nice.
We're excited that you're making great progress, and we want to see, their work. They contributed to get us here. Their work get all the way to the end, and I think there's nothing like seeing a patient's life transformed through things you worked on 5 years ago, right? That's what motivates a lot of these folks. And I think staying connected and showing them that we're going to honor their contributions and legacy by being as successful as we can, and being as disciplined as we can to build a sustainable company that can actually see this all the way through.
Amazing. So just moving on to, I suppose, the patient aspect. So Spur's work is driven by the potential to improve patient lives. How does this focus influence your strategic decisions and daily operations?
Yeah, it's a great question. It's very interesting because I've been around life sciences companies for a long time, and I've met with a lot. And I think the one thing I know is, there isn't a life sciences company that doesn't say they put patients first and they're patient centric. But there is a difference in sort of walking the talk. And I will say my experiences at Vertex really shaped my perspective on this, because I think it told me and it taught me, like, what do I really mean when we put patients first? And, I remember very early on, first of all, I met a lot of patients at Vertex, which was different. We had patients who were doing pilgrimages to our headquarters in Boston to just thank our scientists for the work that they've done that's changed their lives. That's very powerful. And we talked about not sort of the privilege of helping patients, but sort of the responsibility. We owe it to every single one of them. And so if you could do something in 2 months, why can't you do it in 2 weeks? The patients really need us. They're waiting. And a progressive disease like, cystic fibrosis, a progressive disease like Parkinson's, that really matters. And so I sort of brought a lot of that to how I thought Spur could operate. And that patient centricity and that urgency really sort of shaped both our strategy, but also how we operate. On the strategy, it was like, I don't want to be the third Heme B product to market. I want to be the first Gaucher that provides a new medicine for patients who haven't had a treatment advance in 20 years. That motivates our strategy. We want to go after Parkinson's disease because there are no disease-modifying treatments. And we think we've got a piece of innovation in this GCase 85 that we've engineered that could really change the game for those patients. And, we're super excited about that opportunity. That motivates us. That set our strategy. Like, where can we really make the difference? Not just participate, but make a difference. And then I think in terms of how we operate, you probably can talk to other folks at the company, but I like to go fast, and I want everybody's got to do their homework. You got to show up prepared, and there will be bumps. There's no question there's going to be bumps. This is a tough business that we're in, and it's a tough journey that companies go on to actually reach the pinnacle of actually treating patients with approved medicines. But there's no doubt, I expect everybody on my team to, in the face of an obstacle, I want 3 solutions. One way over it, one way around it, and one way under it. Like, figure it out. Mm-hmm. Come with solutions, and we're gonna push. And so there's no doubt we have a very strong sense of urgency. One of our values is being relentless, and I do think that you need tenacity, you need preparedness, and you have to be willing to sort of push through challenges because they're going to come. There's no doubt about it. Nothing great happens without taking some bumps along the road, learning from them, and moving past them. And I think we're a great example of that, just given where we are today.
I think that's amazing, and it actually leads on really well to my last question. And I'm going to just leave it quite broad because I'm actually genuinely interested in your mindset and the way you've spoke. Biotech's pretty volatile as it is, but you've been pretty, cutthroat in decisions you've made, and throughout your career, you've seemed pretty resilient. What keeps you motivated, and what sets your mindset apart?
Yeah, it's a great question. I think probably people closer to me, like my wife, could answer it maybe a little better than me. I'll say a few things. First, as my wife says, I'm sort of a closet optimist. My mantra is we live in reality, guys. Like, fantastical thinking is not going to get us anywhere. I want ambition. I want us to really try to be ambitious and really redefine what gene therapy can do. But I don't want to do it without all the facts, knowing where we have strong science, knowing where our gaps are, and then being very, very critical, sober, and honest about where we think we deserve to be the leader. And so sometimes it comes across as very, very critical, I would say, of the data and our capabilities, but it's just an honesty, because I don't think, hope is not a strategy. You need to really be able to deliver if you're going to try to climb this mountain. It's hard, and you better have the right team, and you better have an honest assessment of, do we have the right rations? Do we have enough oxygen? We have the right gear to get there? And so but I am optimistic, and I see just tremendous.
Is it more a mentality of what could go wrong here in your mind, and making sure you axe all those out, rather than looking at, well, this has to happen, so let's just look at all the bright sides of it?
I think that's a good way of describing it. I would say I've encountered companies where it's like, here's our program, this is what we want to do, how do we keep doing experiments to figure out how to justify continuing the program to get to that goal? I don't like that. That's not my mentality, and it's not the mentality we have at Spur. I do pre-mortems, not post-mortems. Post-mortems, we're already dead. I like to do pre-mortems. Like, what are the things that are gonna really present challenges for us? And in my space, that means investing in CMC. It means investing in manufacturing. Quality matters. The process is your product. You really have to be on top of that. And I'm a big believer in that. And I think you can prepare, and you can prepare well in advance with the right kind of dedication, commitment, and hard work. And I think that's a key to our ability to move quickly. We're going into phase 3 next year. We dosed our first patient in the phase 1/2, probably a year ago. So that's pretty quick. And I think that really is important. I also think, with our research strategy, we just want to know as early as we can if we're on the right track.
Mm-hmm.
I don't need to take a project and push it along, because we've got lots of good ideas. So we are very importantly sort of working on killer experiments, and it's not because I think the project's not going to work. I think the things we're working on now are really exciting, but I want to know. I want to know where our weaknesses are. I want to know, what do we need to do differently now so that we are successful in the future. And so I think some of that, seeing it all the way through and then kind of backing up to your steps and saying, these are the experiments we need to do. And our CSO is fantastic at saying, what are the killer experiments to make us really convicted that we're on the right track here, rather than let's come up with some data that will look good to other people and make them feel good about it. I don't want them to feel good about it. I want us to feel good about it, because if we feel good about it, they'll feel good about it too.
I think that's exactly the right mindset. I mean, I cannot compare in my day to day, but I'm almost a little bit like that with every process I have. Every interview process is, where can that go wrong, rather than looking at it very optimistically and going, well, that's going to happen, and assuming. I think you've got the exact right approach, and it's it's inspiring. It really is. Look, thanks so much for coming on, Michael. It's been an absolute pleasure, and I'm glad you chose me to come and talk about the new Spur and who you guys are.
No, it's been my pleasure. It's been a lot of fun, and like I said, we're incredibly excited about sort of where we sit. It's been quite a journey to get here, and I think Spur really captures kind of the opportunity and the optimism we have with the projects we're working on now. So I really appreciate the opportunity to sort of tell a little bit about our story. So thanks, man.
Thanks so much, Michael. Please like and subscribe to the BioHub. Thanks, guys.